is being recorded.
Good morning, everyone. Thank you to our witnesses for being here today. This hearing, entitled A Race Against Time, Deploying Vaccines and Addressing Disproportionate Impacts of COVID-19 in Latin America and the Caribbean, will come to order. Without objection, the chair is authorized to declare a recess of the committee at any point, and all members will have 5 days to submit statement, strenuous material, and questions for the record, subject to the length limitation in the rules. To insert something into the record, please have your staff email the previously mentioned address or contact subcommittee staff. As a reminder to members joining remotely, please keep your video function on at all times, even when you're not recognized by the chair. Members are responsible for muting and unmuting themselves, and please remember to mute yourself after you finish speaking. Consistent with HRES 8 and the accompanying regulations, staff will only mute members and witnesses as appropriate when they're not under recognition to eliminate background noise. I see that we have a quorum, and I now recognize myself for opening remarks. I have dedicated much of my 15 years in Congress to deepening the United States' engagement in the Western Hemisphere. So it has been deeply painful to see the devastating impact of the COVID-19 pandemic in Latin America and the Caribbean. The region has less than 10% of the world's population, but has accounted for almost 30% of the world's deaths. An estimated 22 million people in this region were pushed back into poverty last year, effectively eroding many of the region's gains in economic development over the last 2 decades. The pandemic's impact have been especially severe for women in the region, who have been 44% more likely than men to lose their jobs. The pandemic has also created nightmare scenarios for many women who have been forced to shelter with their abusers. In Mexico, Argentina, Colombia, calls for domestic violence hotlines have skyrocketed. As we think about the lessons we should learn from this pandemic, I believe one of them is that the epidemic of domestic violence must be addressed with the urgency it deserves. The U.S. government should incorporate efforts to combat and prosecute domestic violence into our foreign assistance programming throughout the region. We have also seen how this pandemic is undermining democratic governance, reducing citizens' trust in government, and leading to greater political instability. The current situation in Colombia, the United States' strongest ally in Latin America, provides a grim foreshadowing of the kinds of unrest we may see throughout the region if we cannot work quickly and effectively to get this pandemic under control. Last Congress, we held 2 hearings to examine the impact of the pandemic in Latin America and the Caribbean and the U.S. government's response. In July 2020, when we hosted the acting Assistant Secretary, Ambassador Cossack, we discussed with him the urgent need in the region for more personal protective equipment and masks. Today, that urgent need is vaccines. I asked President Biden, Vice President Harris, and their administration to answer the call. The U.S. is expected to have over 400 million excess vaccines. Even if we vaccinated every adult in the United States, in New Jersey, more than 7.7 million doses have been administered already, and I am working hard to ensure everyone in my district can easily get access to a vaccine. But the truth is that none of us will be fully safe from this virus until we all are. Time is of the essence, and we cannot afford any further delays. The P1 and other variants are making it even more difficult to contain this virus. That is why I have joined with my colleagues, including Congressman Castro, Chairman Meeks, in calling for Latin America and the Caribbean to be prioritized for vaccine distribution. The Caribbean, in particular, cannot be forgotten. I am glad we have started to send some vaccines to Mexico, but our neighbors in the Caribbean and in Central America should also be at the top of the list. In the coming months, we must go beyond shipping excess vaccines or working with countries to pay for them to also supporting vaccine distribution and delivery. It should be U.S. policy to promote vaccine equity and ensure that the indigenous groups, women, and people of African descent who have been hit especially hard by the virus are prioritized in vaccination outreach efforts. Looking ahead, we should be assessing how we can leverage the United States expertise in the private sector and in our government-funded research institutions to help strengthen health systems throughout the region. My hope is that in the wake of the pandemic, the United States bonds with this region will help emerge stronger than ever before. I look forward to working with my colleagues on a bipartisan basis to advance that goal. Thank you, and I now turn to the ranking member, Congressman Green, for his opening statement.
Thank you, Mr. Chairman, and I want to thank our witnesses for being here today. As the United States begins to reopen, and once all Americans have had a chance to receive the COVID-19 vaccine, we must prioritize vaccine assistance to our neighbors in the Western Hemisphere. China and Russia are advancing powerful disinformation campaigns in Latin America against American vaccine efforts and, of course, the pandemic's origins. In particular, the CCP is exploiting the region's health and economic vulnerability to promote its foreign policy priorities. They're leveraging the public health crisis for investment opportunities and pressing Taiwan's allies to sever diplomatic relations. Unfortunately, it seems to be working. Just this week, President Juan Orlando Hernandez of Honduras, an enduring ally of Taiwan, announced that his country may open a commercial office in China. He said that the CCP wanted a, quote, diplomatic bridge, end quote, before Honduras could buy their vaccines. According to an article in Financial Times titled, quote, Chinese jabs dominant Latin American vaccination campaigns, end quote, China has shipped more than half of the 143.5 million doses of vaccines delivered to the region's 10 most populous nations. Yet worldwide, the United States is by far the largest donor. However, because we're funding this through the multilateral initiative COVAX, the Chinese Communist Party can make it seem like they're the most generous. As China and Russia fill the vacuum in Latin America and the Caribbean with their suspect vaccines, many are resorting to a new trend called COVID shot tourism. Travel agencies are advertising trips to the United States to get the shot. One ad in Mexico says, quote, want the COVID-19 vaccine? Have a U.S. visa? Contact us, end quote. Demand has soared and prices have increased by as much as 40% for flights from Mexico to the United States as thousands from across the Americas try to get their shot here. States and cities are responding. On May 6th, New York City's government tweeted a quote, welcome to New York, your vaccine is waiting for you. We'll administer the Johnson & Johnson vaccine at iconic sites across our city, end quote. Our friends in Latin America are right to distrust the Chinese vaccines. As a physician, I know that the safety of the CCP vaccines, such as Sinovac and Sinopharm, is questionable at best, and their efficacy is extremely poor. Even the director of the Chinese Centers for Disease Control and Prevention admitted that their vaccines don't have high protection rates. Additionally, according to Liberal Human Rights Watch, the CCP has detained vaccine safety advocates, censored information critical of the Chinese vaccines, and spread propaganda and disinformation regarding Western vaccines. Does this sound like a regime that's confident about the safety and efficacy of its vaccines? Of course not. Why should the United States, or what should the United States do to help our neighbors to the south and counter China's malign vaccine diplomacy? For starters, vaccines distributed using U.S. taxpayer money must be branded as U.S. assistance to counter CCP and Russian disinformation. The people of the world must know that it is not communism, but freedom that is bringing these vaccines, reliable vaccines, to the world. We also should be prioritizing aid to Latin America and Caribbean nations, many of whom are struggling with COVID outbreaks and have historically been forgotten. Finally, we need to protect American intellectual property. America's IP laws have helped foster life-saving innovation, including the miraculous success of former President Trump's Operation Warp Speed. Waiving our IP protections would endanger American jobs and enable the CCP to profit from America's hard work and investment. I urge the Biden administration to incorporate these critical points in any strategy of COVID foreign aid. We cannot let Russia, China, or any of our adversaries benefit from a global health crisis. The world is crying out for America's help, and America must answer. America must lead. Thank you, Mr. Chairman, and I yield.
Thank you very much, Ranking Member Green. I will now introduce Dr. Aracho Castro. She is the Samuel Z. Stone Chair of Public Health in Latin America and the Director of the Collaborative Group for Health Equity in Latin America at Tulane School for Public Health and Tropical Medicine. Her research focuses on health equity, women's health, and early childhood development. Prior to joining Tulane in 2013, she was Associate Professor of Global Health and Social Medicine at Harvard Medical School. She holds a PhD in Social Science and Health from the University of Barcelona and PhD in Ethnology and Social Anthropology from the School of Advanced Studies in the Social Science in Paris, and a Master's of Public Health degree from Harvard School of Health. Dr. Castro, we welcome you to our hearing. We will then hear from Ms. Tatiana Bertolucci. She serves as the Regional Director for CARE U.S. Latin America and the Caribbean Program. Ms. Bertolucci has been working with CARE since 2012, and her expertise include issues, excuse me. Ms. Bertolucci has been working with CARE since 2012, and her expertise include issues of governance, gender justice, and participatory budgeting. She holds a master's degree in Latin American Studies from the Universidad Autónoma de Madrid, and is a specialization in communications and culture from Sao Paulo University. Ms. Bertolucci, thank you for joining us today. Finally, we will hear from Dr. Evan Ellis. He is a research professor of Latin American Studies at U.S. Army War College Strategic Studies Institute, where he focuses on the region's relationship with China and other non-Western Hemisphere actors. He previously served on the Secretary of State's policy planning staff with responsibility for Latin America and the Caribbean and international narcotics and law enforcement issues. Dr. Ellis holds a PhD in comparative politics from Purdue University. Dr. Ellis, thank you for joining us today. I ask that the witnesses to please limit your testimony to 5 minutes, and without objection, your prepared written statements will be made part of the record. Dr. Castro, you are recognized for your testimony.
Thank you, Mr. Chairman Cides, for inviting me to testify today. My comments complement the written statement that I submitted earlier this week. As you mentioned, the pandemic is creating great human suffering in Latin America and the Caribbean. Almost 1 million people have died of COVID-19. Latin America has also suffered the largest economic contraction among low and middle income regions. And millions of people have gone back to extreme poverty. According to the Economic Commission of Latin America and the Caribbean, it is expected that people living in extreme poverty are going to increase from 7 million to 78 million. As in the United States, the social determinants of health have come to the fore. Indigenous and Afro-descendant communities and those in the lowest income groups are the most affected, both by the coronavirus itself and by the economic consequences of the pandemic. This pandemic has also brought to light the fragility and underinvestment of health systems and of essential public health functions, such as epidemiological surveillance. There is a shortage of ICU beds, personal protective equipment, oxygen, and health workers. If that weren't enough, around 9,000 health workers have died of COVID-19 in the region, most of them female nurses. Most health systems have not been able to both respond to COVID-19 cases and maintain essential health services for events that happen every single day, such as complicated childbirth, diarrhea and pneumonia among children, and sexual violence. As a result of the disruption of essential health services, maternal and child deaths are increasing by the thousands. In 2021, hospitalization and mortality rates due to COVID-19 have increased among all age groups, and particularly among those under the age of 60. New coronavirus variants have greater transmissibility and greater mortality. Millions of vaccines are needed as soon as possible, and they need to be distributed with ethical and epidemiological principles. Most countries in the region have procured vaccines through COVAX, an international solidarity mechanism, and also through bilateral agreements with vaccine developers from the United States, the European Union, the United Kingdom, Russia, and China. However, as of last Friday, less than 5% of the population in the region is fully vaccinated. At this low vaccination rate, it is going to take a very long time to bring the pandemic to an end. There are different mechanisms to increase the delivery of vaccines in the region. 1, donating vaccines to COVAX immediately. 2, financing the logistics of vaccine rollout immediately. 3, engaging other countries to support the intellectual property waiver at the upcoming World Trade Organization meeting and to redesign obsolete IP laws. The successful precedent with antiretroviral therapies to treat AIDS is proof that collaboration can help boost drug and vaccine discovery and manufacturing in the mid and long terms. And pharmaceutical companies are doing very well, despite the collaboration. Number 4, collaborating with Latin American and Caribbean countries through technology transfer agreements to increase the development and manufacturing of messenger RNA vaccines to respond to the current and future pandemics. And number 5, re-engaging with the region to help improve epidemiological surveillance and help strengthen health systems through the Centers for Disease Control and Prevention and through the Pan American Health Organization. Thank you for your attention.
Thank you very much. I now turn to you, Ms. Bertolucci, for your remarks.
Chairman Sears and Ranking Member Green and distinguished members of the committee, thank you for the opportunity to testify today as you examine the challenges and impacts of the COVID-19 pandemic in Latin America and the Caribbean. These are critical issues, and I'm really thankful for the committee's attention to them. CARE has provided the development assistance and humanitarian relief in the region for over 65 years. We are currently responding directly or through partners in 12 countries, focusing on fighting the structural causes of inequality, supporting the most vulnerable populations, especially indigenous and Afro-descendant women and girls, and migrants and refugees. When the COVID-19 pandemic hit, Latin America was facing major humanitarian crisis. More than 5 million people had fled Venezuela. In Central America, people exposed to violence, hunger, and the effects of climate change were forced to leave their countries. And in Haiti, millions were facing food insecurity. The impacts of the pandemic were deepened by the region's structural challenges and, at the same time, exacerbated the region's inequalities, making the humanitarian needs even more severe. CARE is witnessing them firsthand, as in the story of Maria, a 29-year-old owner of a food post in Honduras that told us, in her words, "We have been locked up and I have not been able to sell my products because I have to go to the market and right now I'm not able to do so. We had help these past days, but I'm afraid we will not die of COVID. We will starve." Or Mercedes, a 36-year-old Venezuelan woman living in Colombia that told us, "The hostel we were sleeping at was shut down by the government because of social distancing. Now myself and my 2 kids are on the street with no place to sleep, with no chance to have any income because everything's closed, and with no way of protecting ourselves from this disease or from people." It is for the many stories like those that my testimony today focuses on the secondary and long-term impacts of the crisis. The International Monetary Fund predicts that the region will face a contraction in its economy of 7%. The unemployment rates are rising and reached 10.7% at the end of 2020. Lack of employment, together with the impacts of climate change, political instability, and income inequalities, drive tremendous poverty growth. 22 million people moved into poverty just last year. We are also seeing food insecurity and malnutrition growing. According to the World Food Programme, the region is expected to see a 269% rise in the number of people facing severe food insecurity. 16 million people don't know where they're going to find their next meal. And women are already eating fewer meals to leave more food for their children. Access to health and education has also worsened. With fragmented and unequal health systems, the region is ill-prepared to handle a health crisis of the scale of COVID-19. Also, 95% of the children are out of school because of COVID. The majority of them don't have access to internet, so they don't benefit from online learning. The caregiving burden is higher for women that are often responsible for the child care, and for girls that are tasked with taking care of their younger siblings and have less time for their own education. As the secondary impacts of COVID take their toll, thousands of people have been forced to flee their homes and face higher risks with the closure of borders. Informal migration routes expose women to higher risks of sexual exploitation, abuse, and human trafficking. Finally, the rise in gender-based violence and the disproportionate rise in unpaid care work for women are 2 trends that are putting women's lives and futures at significant risk. To address these challenges, CARE urges the US government to prioritize 5 key areas in its policy and assistance strategy for the region. 1, ensure fast and fair delivery of COVID-19 vaccines to the last mile and sustainable health systems strengthening, prioritizing investment in frontline and community health workers. 2, elevate humanitarian diplomacy and funding within the US strategy in the region, including facilitating durable solutions to displacement. 3, ensure US humanitarian and development investments have a clear gender focus and support women and girls, including through continued support for sexual and reproductive health and for gender-based violence prevention and response. 4, engage with and support regional governments to ensure safety nets are accessible to the most vulnerable populations now and to improve their resilience throughout the years. 5, direct resources to strengthen the capacity of locally led and especially women-led organizations and prioritize economic empowerment for women and vulnerable groups to bolster resilience and capacity to respond to the current and future crisis. Thank you very much.
Thank you very much. We now recognize Dr. Ellis. You're recognized for your testimony.
Chairman Sidis, Ranking Member Green, distinguished committee members, thank you for this opportunity. I will summarize my written testimony. No region in the world is more directly connected to U.S. security and prosperity than is Latin America. The region has reported approximately the same number of COVID-19 cases as the United States, yet has 50% more deaths, over 960,000 as of May 11th. Our informal sector and businesses have made its population particularly vulnerable to both contagion and the adverse economic effects of fighting the spread of the virus. The region's GDP declined by 6% in 2020, and many countries worse. Many small businesses bankrupted by the pandemic are gone for good. This past week's violent protests in Colombia, the burning of Guatemala's parliament building last November, and other unrest across the region that its governments are at their limits. Indeed, with the COVID-related spending, government debt in the region, according to from 68% to 77% of GDP just last year alone. The region's government is noted to have not been able to obtain and distribute adequate quantities of vaccines, either directly with manufacturers or through COVAX. Only 2 countries in Latin America, Chile and Uruguay, have 80% of their population. China, Russia, and even Cuba, as Ranking Member Green noted, have stepped into the breach. The PRC is currently supplying vaccines to at least 12 Latin American countries. This represents 85% of vaccines received by Chile to date, 82% of vaccines received by El Salvador to date, and 75% of vaccines received by both Brazil and Uruguay. At least 10 Latin American and Caribbean countries are using Russia's Sputnik V vaccine, including Venezuela, Nicaragua, Bolivia, Argentina, and Mexico. The PRC is using access to its vaccines to promote its interests in other areas, as Ranking Member Green noted. Following PRC vaccine promises, both Brazil and our ally, the Dominican Republic, reversed prior public commitments to exclude Huawei from their 5G network. In Paraguay, the PRC tried unsuccessfully to use vaccines to convince the Abdel Benitez government to abandon diplomatic relations with Taiwan. And their maneuvering with Honduras has also been noted by Ranking Member Green. Nonetheless, China's vaccines have had efficacy problems. Chile's government bet on Sinovac to get shots to more of its population than any other country, but Sinovac turned out to have only 3% efficacy after the first dose, allowing the virus to continue spreading. China's marketing of its vaccine contributions masks a less positive return. The PRC sells most vaccines. Indeed, the PRC set up a $1 billion loan fund to help Latin American countries buy its vaccines, just like the PRC loans money to the region to hire Chinese companies in other areas. The Chinese have, however, aggressively marketed the vaccine rollouts. They have turned just about every vaccine delivery into a photo op on the airport tarmac. Such marketing creates the false impression that, in the face of U.S. indifference, the PRC is generously saving our neglected neighbors. The Russians, for part, have had production problems, resulting in only limited deliveries of 5, but even Cuba has gotten into the vaccine game now with its Sovereign 2 and Abdala vaccines. It is in our strategic interests to help our neighbors to more rapidly and effectively vaccinate their populations. First, the United States will have the vaccine to start. As of May 12th, 58.7% of the U.S. population, according to the CDC, have received at least 1 dose, with more vaccine in the pipeline. Second, controlling the virus in Latin America is important to minimize the risk of mutations or variants, such as the previously noted P1 variant in Brazil, and their transmission to the United States, especially given the high level of U.S. personnel interchange with the region. Third, helping control COVID in the region is arguably a necessary precondition to ease migratory pressures and alleviate socioeconomic stresses that could help bring anti-democratic populist governments to power, farther opening the door to worrisome forms of engagement by China, Russia, and Iran. Fourth, U.S. vaccine leadership strengthens our neighbors' goodwill to work with us in other areas that we value while fighting China and Russia's false and self-promoting narratives. I thus respectfully recommend the following. First, that we donate, not sell, significant quantities of vaccines from proven Western manufacturers, highlighting U.S. generosity in contrast to Chinese profit-seeking. Two, in addition to COVAX, we should work directly with trusted Western manufacturers to obtain additional vaccines for the region. Three, we're accepted by partner governments. We should provide logistics support for the transport, storage, and distribution of the vaccines, possibly even using the U.S. military where appropriate, complemented by international observers and NGOs, thus reducing the risk that vaccines will be diverted or used by local elites to support their own interests or enrichment. Thank you for your time and interest. I welcome the committee's questions.
Thank you, Dr. Ellis. We will now go to questions. I have been advocating for a number of months for the U.S. to donate excess vaccines to the region. I was happy to hear the White House announcement that the U.S. will share 60 million doses of the AstraZeneca vaccine with the world. Dr. Castro, how should the United States prioritize where vaccine doses are sent within Latin America and the Caribbean?
Throughout the region, there is a very uneven distribution of vaccines, and we should follow epidemiological priorities to start to deploy vaccines. One mechanism is through COVAX, which already, through the revolving fund, is distributing vaccines. And there could be an agreement to make sure that those vaccines are first distributed where they are needed the most. Usually that entails the cities that are highly dense with populations where transmissibility occurs more rapidly. But first of all, I would start with healthcare workers who are the most exposed to the virus, following people who are the elderly and those with chronic conditions.
Thank you. The COVID-19 pandemic has worsened a humanitarian crisis in Latin America and the Caribbean due to pervasive inequality, fragile health systems, and corruption. Ms. Bertolucci, where is the U.S. assistance most needed right now?
Thank you for the question. We do need to focus the U.S. assistance, both the humanitarian response, but also the support to fighting the root causes that are making people more vulnerable to this crisis that I mentioned in my testimony. The support is needed, especially in Central America, responding to many of the crises that I've mentioned, but also in South America, supporting the countries receiving the Venezuelan refugees and migrants, and in Venezuela itself. Finally, as you mentioned, Representative, the Caribbean must not be forgotten, as they are facing already food insecurity, especially in Haiti, and also we are expecting a very difficult hurricane season that is starting right now, which will increase the humanitarian needs in the region.
Thank you. Dr. Ellis, I have said for a long time that if we do not pay attention to our own hemisphere, countries like Russia and China will fill the void the U.S. is leaving. They have taken advantage of this during the pandemic, offering almost every country in the region vaccines. How do we combat that, Dr. Ellis?
That's an excellent question, and I fully support your observation, Mr. Chairman, regarding the importance of the hemisphere. I think number one, it's important. The United States has been very generous. This administration, as you know, is committed $4 billion through COVAX. Unfortunately, the Chinese play, as Member Green noted, a much better game in terms of claiming credit for the vaccine. I think it's important that we take advantage of existing private sector mechanisms and existing mechanisms to get more vaccine directly, both the surplus vaccine that we have and others. We also need to do a better job in engaging with the region to emphasize the efforts that we are doing. And frankly, beyond that, I believe that we need a sustained investment in the region to continue to push back against the grave socioeconomic and other conditions that have been unleashed by the virus. Not only the economic conditions that have been there, but also pressures for public insecurity and other things that will continue to push regimes to open the door for the expansion of new populist governments that traditionally have farther opened opportunities for China and Russia to advance in the region. There are a lot of pressures, both fiscal pressures and other pressures for that Chinese advance. And so we need to be a friend and ally supporting strengthening governance initiatives as well as the vaccine rollout itself, Mr. Chair.
Thank you. I now recognize Congressman Green.
Thank you, Mr. Chairman, and really appreciate your leadership here on this. I also want to cite that I appreciate your continuing to advocate that this vaccine, that we share our vaccines with our friends in Latin America. You know, we've seen actors like the Chinese Communist Party, Russia, and Iran wage very intentional campaigns to undermine the Western vaccine effort. They're raising questions about the origins of the pandemic, shaping the narrative there. Dr. Ellis, how do these disinformation campaigns affect public health response efforts in Latin America?
It's a question. First of all, it creates the impression that the rollout of the Chinese vaccine is adequate. This was a problem in Chile, again, due to the limited efficacy of those vaccines, despite Chile leading the campaign in vaccinating its countries in the region. It discovered that the vaccine was continuing to spread. In addition, the impression of China and Russia, as I noted, coming to the supposed rescue of the region, creates the narrative that the United States is not there, the United States does not care, and that undermines our efforts to engage with our allies in other ways, whether it's promoting democracy and human rights or free markets and open governments. And frankly, it opens the door for cooperation with the Chinese in other areas. Some of those areas, as you noted, sir, include, for example, the pressure in order to open up the market for example, Huawei and 5G, which creates a very serious intelligence and opportunities for the Chinese that can even put the autonomy of member governments and their leaders at risk. It also puts our ally Taiwan in a very precarious position, as you know, sir, with respect to both what's happening in Honduras and Paraguay and pressures elsewhere. And traditionally, as we've seen already through El Salvador, which is launching a major new project with the Chinese just this week, as well as advances in the Dominican Republic and Panama, those open doors for the Chinese lead to dramatic expansion of Chinese commercial presence, which has a silencing effect and often an anti-democratic effect. In addition to, again, helping open the door for other populist governments that, again, has a mutually reinforcing effect of farther creating even more opportunities for the Chinese in other areas.
So how do we push back on this, and how do we recruit some international partners to help us in this fighting this disinformation campaign?
If that's for me, sir, an excellent question. First of all, I believe that we need to be very careful in not trying to tell the region that they are not allowed to economically engage with the Chinese. We believe in the principles of a free market and obviously principles of autonomy of states. But there's a lot more that we can do with respect to promoting principles of good governance, pushing for transparency, which makes it more difficult for countries, for elites in the region to engage with Chinese in under-the-table deals, which ultimately benefit those elites and the Chinese without benefiting their populations. We need to help our countries in the region fight corruption and also strengthen the ability to implement solutions that involve open playing field, rule of law, effective public planning to prevent situations like what happened in Panama, where the previous governor of Juan Carlos Varela signed up for a $4 billion bullet train spending people's money that wasn't even in the plan. We need to help our governments in the region to enforce their own laws under their own sovereignty so that Chinese companies can operate on a more effective playing field. And frankly, we need to bring to bear more resources with respect to the Chinese in terms of looking at the long record of where the Chinese companies have not lived up to promises, where they have problems with local communities, where they've had environmental issues and other things. Because at the end of the day, we need to give data-driven reasons why our partners should not accept those false promises and why democratic free market solutions are the most viable path for their prosperity and development. And of course, to ours, because we are deeply connected to the region.
I only have a few seconds left, but I would love to get a response in writing back from all of our witnesses today on the following question. You know, Congress passed $15 billion in aid through supplemental appropriations. I'd like to know how state, USAID, and the NGOs are responding to that. Are they doing a good job with that aid? Is it being appropriately administered? And since my time is now up, if I could get those answers in writing, that'd be helpful. And thank you, Mr. Chairman. I yield.
We now recognize Congressman Castro.
Thank you, Chairman. Ms. Bertolucci, thank you for your testimony today. As you've stated, the COVID-19 pandemic has exposed existing structural challenges and exacerbated inequalities affecting vulnerable populations across Latin America. This is certainly true for migrants and refugees who've been displaced across the region and may lack access to health care and recourses to obtain a COVID-19 vaccine. So I wanted to ask you, how can the United States work with Latin American countries and civil society organizations to make sure migrants and refugees receive the COVID-19 vaccine?
Thank you so much for this question. I believe there are several things that the U.S. can do to support the governments. The first one has been very much discussed right now, which is ensuring a fast and fair distribution of vaccines, augmenting the capacity of the several states in Latin America to have availability of vaccines, and therefore not having to choose who are they vaccinating and who are they excluding from this process. We need to also advocate and guarantee that not only the vaccine reach the countries, but also that the health systems are strengthened, and the frontline workers and community health systems are strengthened so that the vaccine can be distributed to the most remote communities, to the communities that are on the borders or walking through Latin America, which is a reality for the Venezuelans, for instance, and also make sure that we are looking at the most vulnerable populations as part of the targeting strategy for the vaccines. Finally, focusing only on vaccines will not solve the huge displacement and needs that the migrants and refugees have at this moment in Latin America. So we do need to step up on our humanitarian response and humanitarian funding to make sure that they have not only access to health, but access to food security, access to education, and access to the basic protection, especially for women and girls. So those are some of the areas that I believe the U.S. could invest to support migrants and refugees in the region.
Well, thank you. I have a question for Dr. Castro. Thank you for being here today as well. And I agree with your statements on the importance of donating excess vaccines to Latin America and of supporting the intellectual property waiver at the upcoming World Trade Organization meeting. During your testimony, you also mentioned the possibility of having the United States government work with the governments of Mexico and Brazil to expedite their manufacturing development of COVID-19 vaccines. I think that this is a great idea, and it could be a long-term plan for generating sufficient COVID-19 vaccines for the entire region's population. So I wanted to ask you, can you explain how assisting Mexico and Brazil in the manufacturing of COVID-19 vaccines could help the region in their long-term recovery from the coronavirus pandemic? And what are some of the steps the United States government needs to take to make this a reality?
Thank you, Representative Castro, for your question. Indeed, Brazil and Mexico have the largest populations in the region, and they also have plants where they are producing vaccines. And however, they do not yet have the technology needed to produce vaccines such as those that have messenger RNA. And that's where the United States can be very helpful, given that two of the most efficacious vaccines are based in the United States, and those are Moderna and Pfizer. And Moderna has been produced mostly with taxes from taxpayers in the United States. And it would be a great idea if the National Institutes of Health, which has contributed vastly to the production of the Moderna vaccine, could get into agreement with researchers in Brazil and in Mexico to transfer that technology. And that technology can help produce vaccines for the current vaccine, but because the mRNA is a new technology, it could also be very useful to treat future diseases. To treat diseases in the future, and also to produce vaccines for upcoming pandemics. So I believe that collaboration between the United States through the NIH and through vaccine developers such as Moderna and Pfizer, working in collaboration with, for example, the Fiocruz in Brazil, which has a very long tradition of producing medicine and vaccines. There is also the Institute Butantan in Brazil. And there is an agreement between Argentina and Mexico where part of the initial product for the vaccine are produced in Argentina and then they're finished in Mexico. And that is also an agreement that could be potentiated so that more vaccines are being able to produce. Again,
thank you. Thank you. My time has expired, but I appreciate it.
Thank you. We now recognize Congressman Pfluger.
Thank you, Mr. Chairman, for this important hearing, and I appreciate your comments, especially on the rise of the influence of the Chinese Communist Party and of Russia. And so I'd like to focus my questions first, Dr. Ellis, with you. We've seen how actors like the Chinese Communist Party, Russia, and Iran are waging campaigns to undermine Western vaccine efforts and legitimate questions about the origin of the pandemic. So how do these disinformation campaigns affect public health response efforts, and what other efforts, disinformation efforts, exist in Latin America?
Thank you very much, Congressman, for the very important question. With respect to the efforts, obviously they undermine the United States position at a number of different ways. Number one is it contributes to the undermining of goodwill toward the United States, and thus the sense that the United States is a key partner, and what the United States stands for is the right way to go in the region. In many ways, it contributes to a form of moral equivalence. The desire in the region to take the Chinese money in various other commercial endeavors. And if one can think there is somehow a moral equivalence or U.S. neglect, then why not take the Chinese money? Thus taking the elites down a very troubling path that goes into dependence on the Chinese companies, because at the end of the day, the Chinese are seeking to get the value added out of their commercial endeavors. In my judgment, the Chinese and the Russians and others are playing a slightly different game here. The Russians have been even more actively involved in trying to spread false rumors and sow discontent and play up stories on the internet to undermine U.S. allies. The Chinese have been particularly pressing, doing everything that they can to suppress information about the Wuhan origins of the coronavirus and the investigations into the origins, obviously, in the Wuhan virology lab. And so it's become very clear that anyone who raises that question, even our allies outside of the region, the Australians, when they dared to raise those questions, were subject to very harsh economic reprisals. And so I think not only is it undermining the U.S. position and delivering the region more rapidly into economic dependence on the Chinese, but it also shows the way in which it's not just about economics overall. It's about things that both Republicans and Democrats, I think, hold dear. There's a self-censorship effect. There's a silencing effect. Anything that is objectionable to the Chinese, and the more that we see Chinese power and dependence grow, I think we will see an undercutting of the U.S. position and our values that we fight for in the region, and frankly, a region in which its leaders, its political leaders, its elites do not feel free to speak out or question the Chinese is not the type of region that we stand for, nor that I think that many in Latin America want to live in. So I think there's a lot more at stake than just the economics, and but we certainly need to get the virus under control through vaccine leadership as well, sir.
Thank you, Dr. Ellis. Dr. Castro, I'd like to just kind of ask you, through the lens that you're looking at, do you see, some of the similar lines of effort through disinformation or vaccine diplomacy, and do you see them negatively affecting the various countries?
Thank you for the question. The efficacy of the vaccines varies a lot, and my concern is that Sinovac has only 51% efficacy, and it is being distributed throughout the region. And the problem is that it is going to be more difficult to reach herd immunity with vaccines that do not confer a greater protection. So there could be a disinformation in the fact that some people may think that all vaccines are equal, and that is not correct. So definitely we need to make sure that the vaccines that are the most efficacious are the ones that are most widely distributed, and to reach herd immunity, which would mean that about 2/3 of the population is vaccinated with efficacious vaccines. Thank you.
Thank you very much, and I appreciate all three witnesses and their testimonies for this important subject. I yield back.
Now recognize Congressman Levin.
Thank you so much, Mr. Chairman, for holding this really important hearing. It's my understanding that 10 countries in Latin America and the Caribbean are eligible for vaccines through COVAX AMC. And of those 10 eligible countries, only Haiti is waiting still on any doses. The Miami Herald reported last week that Haiti is supposed to get 756,000 doses of the AstraZeneca vaccine. According to the Pan American Health Organization, I'm quoting, Haiti is still in the process to finalize the arrangements that all the other countries have made to be able to receive these vaccines. Haiti is not paying for these vaccines, but the country needs to make some legal and administrative arrangements, end quote. The same Miami Herald report noted that in order to get the doses, Haiti's health ministry must make sure personnel are trained, that there's a plan for storage, and that other logistical details are in order. I'm worried that this delay will be compounded by the COVID crisis in India, which is planned to send roughly 1 billion doses of AstraZeneca to COVAX before halting their exports. I know Haiti was slated to receive a portion of those doses too. So, Dr. Castro, let me start with you. Are you able to share any additional details on why Haiti hasn't received any vaccine doses through COVAX yet?
Thank you for your question. The information that I have, it's through NPR. Last week, it was published that actually the Ministry of Health of Haiti had told the revolving fund that they didn't need the vaccines because the pandemic is not having such a large impact. Of course, it is difficult to understand why there wouldn't be more transmission of the coronavirus in Haiti, given all the very dire conditions in which most of the population live, and given that it shares the island with the Dominican Republic, where thousands of people have died of COVID-19. So I don't have additional information, but I can find out and provide you with a written answer about this topic.
I would appreciate that. I've also heard reports that last month Haiti's Ministry of Health voiced concerns about the AstraZeneca vaccine safety and asked Gavi to consider making a one-shot vaccine. And so, do you have a sense that the Haiti's Ministry of Health is rejecting the AstraZeneca vaccine? Do you have that sense?
Well, what I read in the NPR reporting was that they didn't want to receive the vaccines that COVAX, that the revolving fund was about to ship to Haiti. But again, I will find out and provide you with a better answer.
All right. Well, thank you. I appreciate that. You know, in recent months, many countries in the region have experienced setbacks to democracy and authoritarian efforts to undermine democratic institutions and significant social and political unrest. On May 1st, President Bukele's allies in El Salvador's Congress removed constitutional court judges and the attorney general, and then proceeded a few days later to provide themselves blanket immunity for virtually any act of official corruption related to the pandemic. President Bolsonaro in Brazil is being investigated for his government's severe mishandling of the pandemic. And Colombia is experiencing massive social unrest, with human rights organizations having documented excessive use of force by police. Dr. Ellis, how should the U.S. respond to democratic backsliding in the region made worse by the pandemic? What tools can we in Congress use to push back against these anti-democratic tendencies?
Congressman, you raise a very important point, and there are some very complex strategic trade-offs that we have to obviously work with, remaining consistent, because at the end of the day, it's really the fight to strengthen institutions and ensure democratic practices that is at the heart of what we stand for, and pushing it back against China. And yet we need to be careful at critical moments that we don't inadvertently push allies into conditions in which we actually push them into populist revolutions or push them into the hands of China, liberating them from their constraints of dependence on the United States, and frankly making things worse for the people. But I think one of the key things you also brought up is respect to the pressures and corruption that are really threatening not just public health, but undermining the stability, the political and socioeconomic stability of the region. That creates very, very serious challenges for us.
All right, well, I see my time's expired, Mr. Chairman, so thanks, and I yield back.
Thank you. We now recognize Ms. Salazar.
Thank you, Mr. Chairman, for holding this very important hearing, and unfortunately what we're hearing is very troubling. There is something called a race for vaccine diplomacy, and we're getting outplayed by China and Russia for what we're hearing. We invented the best vaccines in the world, but very few people know about it. We gave $4 billion to the global COVID-19 relief through COVAX, but we've given more than any other country, but most people don't have a clue that's happening. While the American companies, Pfizer and Moderna, have saved millions and millions of lives, Russia and China are pumping questionable vaccines in Latin America and demanding political loyalty in return. So we have worked miracles, literally miracles, yet China and Russia are taking the credit for it. So in other words, we're getting outmaneuvered by communist propaganda that trades on power and destroys countries. So they're eating our lunch, and we have no apparent strategy to counter this new form of aggression from China and Russia. China wants to own the Panama Canal. Russia is supporting Venezuela and Nicaragua dictators. And the vaccines are their new tool. And look what they've done. We have just discussed it in this hearing. China is providing vaccines to Chile, Uruguay, and Brazil, Russia to Argentina, Bolivia, Mexico, and Venezuela. And where are we? The United States. But the good news is that by this July, this country will reach a vaccine surplus. We will have more doses than people who need them in this country. In the meantime, we know that Latin America can make the vaccine, but they desperately need one. So there is a vacuum. If we do not fill that vacuum, China and Russia will. It will be us versus them, and obviously we always bet on America. So that's why I'm proposing to protect American intelligence property so we can make sure China does not get its hand on our most valuable technology at this hour. We should deliver surplus vaccines directly to Latin America and put the American flag on every single vaccine dose we give out, so everyone knows who is giving it to them, who is saving their lives once again, like we have done for centuries, in exchange of nothing, just because we love the common good. So I just wanted to ask you a couple of questions, Dr. Ellis, and thank you very much for coming and spending your time and giving us your knowledge. I just wanted to ask you, do you know that there is a within the State Department, there is a group called the Bureau for Crisis and Contingency Response, the CCR, who was able to fly dozens of planes across the globe carrying almost 200,000 vaccines to our diplomats so we could protect our diplomatic personnel. Are you aware of this group within the State Department?
Yes, ma'am. You raise a number of excellent points. I had the honor of spending a unforgettable year of my life on the policy planning staff, and the State Department has capabilities across a range of different areas. In addition to the things that we have for our own personnel and to support U.S. nationals, there are also a number of other tools, for example, through the Global Engagement Center and others, to more effectively push back against China's propaganda. We certainly need.
So you know that these people are there, and we could use them to fly millions of vaccines to Latin America after we have this surplus that everything indicates we're going to have it by July.
I would have to do a more detailed look at the scalability of those current efforts. There are probably a range of different tools that can be used, including certainly with the Department of Defense and some of those logistics capabilities that it has as well. But certainly, state does have a short turnaround in-house tools to deliver limited quantities of vaccines and other logistic supplies to the region. I would have to look into the scalability of that effort.
But so that means that if the Biden administration has the willingness to help Latin America, we could fly and provide those extra vials starting July when we have a surplus in this country. So it's just political willingness.
I think we certainly, ma'am, I agree with you. We have the vaccine. We, across our whole of government capabilities, we have a number of different instruments, as we found out in response to the Ebola crisis in Africa not too many years ago as well. Exceptional capabilities to do things quickly. I saw it at state when rescuing them and getting them out of harm's way as the crisis took off in the region last year. So whatever the particular capability is appropriate to this, so we absolutely have the capability, and we increasingly have the surplus vaccines.
So don't you think it would be a good idea to use those?
Thank you, Congresswoman.
I'm sorry.
Salazar.
That I thank you, but I just want to put on the record, there's this article by Vanity Fair that says that we have the vials and we have the capability of distributing them. It's just willingness. Thank you, Mr. Chairman.
Thank you. Congressman Vargas is recognized.
Thank you very much, Mr. Chairman. I appreciate you very much having this hearing and, of course, the witnesses. I want to continue on with this line of questioning because I think numbers matter here, though. So how many extra vials do we have right now, and how many people are in Latin America? I mean, I was just looking up the numbers of some of these countries. So Brazil has over 211 million people, Mexico 127 million, and Colombia 50 million. I mean, these numbers are huge compared to the vials that we have, let's be frank. I mean, if we took all the extra vials right now and we sent them to Latin America that we have, how many would that be? Who can answer that? Evan, Mr. Dr. Evan. You make a good point with respect to the number that we may have in stores at this moment versus the question of what is in the pipeline and would also be freed up in the pipeline based on certain decisions that we make. I don't have the specific number of what we have in inventory right now, but my understanding. 400 million? We have 400 million vials ready to go?
Yeah. What I believe, sir, is that if we make commitments through existing or adjustable commercial relationships with our existing Western-based manufacturers, that we can keep that pipeline ramped up as our own demand in the United States ramps down so that...
You don't want to give me a number, though. No? Does anyone want to give me a number? See, that's what I think the problem is here. We're talking about numbers that are small that we have, and we're talking about gigantic numbers that they need. That's the problem. So even if we gave them all the extra vials, there's not that many extra vials, let's be frank. I mean, we don't have it right now. That's the problem. I mean, you have, 19% of the COVID-19 virus in the region. You have 8% of the population, but 8% of the population is huge. So at the moment, we don't have enough. I mean, that's the reality. The Chinese have been good, I think, about saying, hey, we'll give this to you, even though their vaccine's pretty crappy, but it's something, so they'll take it. But we have to have the ability to give them some vaccines. I mean, that's the issue. And how do we do that? Dr. Castro, how do we do that?
Well, some numbers is that through COVAX, the current goal is to provide 280 million doses by the end of the year. And if we take into account that most people, because of the type of vaccines, are going to need 2 doses, that means 140 million, and for a population of 660 million. Of course, that 660 million includes children, and right now we still don't know if they can, if it's safe to provide the vaccine, but it's true that we still need millions of doses to be delivered.
Yeah, now I do have the concern that some of my colleagues on the other side of the aisle do. I mean, COVAX AMG is great, but the reality is that we should have on there, provided by the United States of America. I do agree with that. That's something that we should insist on. I mean, if we're providing the money to do this, we should get credit for it. And not because we want to get credit for it, because I think it's good for democracy. I think it's good for the people there to understand we're doing this because this is what free countries do. This is what democracy does, as opposed to the Chinese who do it for self-interest. They're doing it because they want something out of it. They want to take their canals. They want to take their raw materials. So I do think it's important when we provide these vaccines that they know that it's coming from the United States of America. But at the same time, we have to be realistic about it and understand that, yes, we could fly down what we have right now and you could, get a very few people vaccinated. But the reality is it doesn't really cover the great majority of the people there. We need a better plan. And that's what we have to come up with, a better plan to figure out how do we help vaccinate everyone in Latin America that wants it. And hopefully everyone will want it, because we won't be safe until they are. Am I wrong about that?
You're right. We need to immunizing, even if everybody in the United States wanted to be vaccinated and we achieved herd immunity, we would not be safe in the United States until at least 2/3 of the population in every single country in the world is vaccinated.
And that's why I think we do need this plan to try to figure out how are we going to help Latin America and the Caribbean get fully vaccinated. I mean, it's interesting to talk about these little things. We can send them a few vials here, a few there, but that's not the scale that we need. We need a plan that's really going to do the job. I see my time's up, so I will yield back. Thank you.
Thank you, Congressman. And I certainly agree with you. Should say on it, made in the USA. Well, thank you again for joining us today, all the witnesses. I want to close today's hearing by once again urging the Biden administration to take immediate steps to support vaccine distribution in Latin America and in the Caribbean. I look forward to working with Ranking Member Green and our colleagues to deepen U.S. engagement with our allies as we work to get this pandemic under control throughout the Western Hemisphere. With that, this committee is adjourned.